are we at risk of whether it's the Delta variant or another strain of the virus mutating into a variant that is not that vaccines are not efficacious against?
Yes, that is a very serious risk. The more spread that we have of COVID-19, the more likely the viruses that are circulating to mutate. So every person that gets infected with the virus that causes COVID-19 produces various variants themselves. Some of them have no consequence, but others may uh, have mutations that change the characteristics of the virus, how easily it's spread, how severe the illness is when people get it. So right now, the Delta variant that is spreading in Arkansas is very infectious and it causes more severe disease and in younger people. It's possible for that Delta variant to further mutate, and it's more likely to do so the more spread that there is. So the best way to prevent these new variants from developing is to suppress the spread, and the best way to do that is to get vaccinated.
Um, Another common question we got last week, and we get it every week, since COVID-19 came to Arkansas, and we developed the vaccines, is how should vaccinated individuals proceed? Should, particularly in situations where they'll be in prolonged contact with unvaccinated individuals, church, family gatherings, etc. Should people live their lives? Should they take precautions? What I'm vaccinated. What now should I do?
So the CDC right now says that people who are fully vaccinated can go without a mask, but they also state that people who are at higher risk for severe disease uh, may wish to take additional precautions, and that includes wearing a mask, practicing social distancing, avoiding groups or crowds where they are likely to be exposed, such as places where there would be unvaccinated people not wearing face masks, or situations where there's poor ventilation. I would say the majority of people in Arkansas are at high risk for severe disease because one of the factors are chronic health conditions. So, and this include being overweight or obese, having diabetes, high blood pressure, heart disease, kidney disease, all kinds of chronic conditions that most people in Arkansas have. So one way that the people of Arkansas who have these conditions can further protect themselves is to wear a mask, practice social distancing, and avoiding places where they would likely be exposed.
And it's kind of been in the news a lot this week, the breakthrough cases and the small percentage of fully vaccinated individuals that do become infected. Is there data or research right now that indicates who those people are? Are they people with the pre-existing conditions that are at risk, or who are having some sort of drug interaction? Is there any indication about who the vaccinated individuals are that do still get sick on occasion?
So we do see what we call breakthrough cases, people who are fully vaccinated and still at some point test positive for COVID-19. And there is a range, and we haven't looked specifically at certain health conditions or not, but just about anyone who's fully vaccinated would be at increased risk, but especially people with chronic health conditions, and people who are 65 and older. Because those conditions, or just even if you're healthy and 65, your immune system may not respond as robustly to the vaccine as other people. So those are the folks that may wish to take extra steps to protect themselves, such as wearing a face mask, practicing social distancing, and avoiding places where they might be exposed.